Cold weather injuries such as frostbite can develop in minutes. Learn how to prevent frostbite. Answers from AboutKidsHealth.ca at the Hospital for Sick Children. Cold weather injuries can be life or limb threatening. The best way to avoid them is to be aware of the weather before going outside. Frostbite happens when tissues freeze because of restricted blood flow, usually in fingers, toes, ears, or nose. Frostbite can be superficial, only affecting the skin, or deep, affecting body tissues below the skin. Frostbite can be an emergency. If not treated, it can lead to severe injuries and even loss of digits or limbs. Wind chill factor measures how much colder the body feels and how much faster the body loses heat depending on how much the wind is blowing. Keep children inside when the temperature with or without wind chill is below minus 27 degrees Celsius, and limit their time outside when the temperature with or without wind chill is below minus 15 degrees Celsius. Dress children appropriately for cold weather. Use layers and cover areas that are commonly affected by frostbite with mittens, hats that cover their ears, and waterproof boots. Have your child take breaks to warm up inside throughout the day. Ask them if they are cold and remind them to keep their winter clothing on. Kids may not notice early signs of cold injury, but if a child is shivering, it is time to head back inside. Babies and toddlers are at greater risk of frostbite as they cannot communicate if they are cold. Encourage older kids and teens to use the buddy system when playing outdoors to spot frostbite early. A child with superficial frostbite will feel burning, numbness, tingling, itching, or cold sensations in the affected area. This area may appear white or more pale than usual. As frostbite worsens, feeling fades, skin turns white and waxy, and swelling sets in. The area may feel stiff, clumsy, and develop fluid-filled blisters. It may be difficult to move the affected area. Severe frostbite can turn skin black. Milder cases may cause pain and peeling after rewarming. Frostbitten skin is more vulnerable to future damage. Move indoors to prevent further heat loss. If your child's feet are frostbitten, carry your child somewhere warm to prevent tissue damage. Elevate the affected area. Give your child warm, non-caffeinated fluids to drink. If no warm drinks are available, have your child sip water. Remove wet clothing. Do not rub the affected area. Do not heat the area with anything hot enough to burn the skin. Keep your child warm. Use a blanket in a warm room or your own body heat. You can place the affected area under your armpit. You can also rewarm the area with warm, not hot water. If your child has deep frostbite, call or see a healthcare provider right away and use all the treatment measures previously described. Do not start warming the affected area if the warming cannot be continuous. Thawing and refreezing will increase tissue damage. Only thaw when you are sure the area will no longer be exposed to the cold. If fingers or toes are affected, place dry bandages between them to avoid rubbing. Thawing can cause dull, then throbbing pain lasting days. Skin may turn purple or blue as blood flow returns. The amount of tissue damage may not be known for some time. Frostbite is avoidable with proper winter clothing and by avoiding prolonged exposure to cold temperatures. For more information about frostbite and other health topics, visit AboutKidsHealth.ca.